1, go.
Hi, my name is Brock Brascio. Thank you for making the call. And I also thank David Fletcher, Dr. David Fletcher, for lending his expertise and taking his time for this call. A couple of things before we get started. Number one, there's not enough time on this call to go through full interpretation and case studies. If you decide to get an Insight subluxation station, it comes with interpretation DVDs that help with that. And also at our Total Solutions seminar, Dr. David Fletcher actually gives 2 sessions, 3 hours each, on interpretation. So there's plenty of time later for the interpretation and case studies. The second thing is limit questions, because we've got such limited time now. If you have questions later, you can contact me and I'll respond. My email is Brock, B-R-O-C-K, @subluxation.com. My phone number is 1-770-456-0178. Thank you. And now I'll turn it over to Dr. David Fletcher. David?
Thank you, Brock. It's always a great pleasure to have a chance to speak with you. And, of course, we get a chance through this call to connect out to many of the doctors who I've had a chance to either speak with or who know me already. So it's nice to have familiar voices, at least me speaking to them. So I wanted to begin by saying that when I get invited to do a call like this, I sit down and I try and think what's probably some of the most important points that I can make in a short period of time. And I think that the most important point to get across is that I use this technology every day in my practice. I, like you, have to wake up, get into the practice, and decide how we're going to change people's lives and their perspectives by using the chiropractic message with them. We know that so often our patients have symptoms or have histories of symptoms, and they really want to use a chiropractor to catch them and get them out of this problem. But we also know that our mission within chiropractic and within practice is to try and teach people the full value of what we ultimately believe is lifetime care. And, I think that one of the things that we really realized over the years is that more and more as we use just a structural model, which was really either using just limited to X-ray alone or limited to or through neurotesting, the simple stuff that was taught at the CMCC model, we got the patients through their crisis time, but we needed something to, invigorate their ideas about what chiropractic could be. And, of course, minimally we wanted them to buy into the principle of prevention, but prevention isn't what really the whole story of chiropractic is about. It's really about trying to develop this sense of feeling alive again and keeping them on a wellness track. And so this is where we need to bring the nervous system into the whole picture. And having had just a conversation yesterday with Dr. Kent, CLA has had 27 full years of reinvigorating the message of bringing functional neurology back into the chiropractic offices. And, of course, until we can get the patient to realize that this pain that they have is associated with something that could be changing their health, then they're just going to focus on trying to manage their pain. So we have a series of tests, which we now understand is the NSFI, which is the Neurospinal Functional Indices, and we collect 5 data points from 5 different functional parts of the nervous system as it works with the spine, hence the neurospinal, and we then correlate them into what is called the functional indices. And what we're really looking at here is a numeric or a numbered value as to how functional this relationship between the spine and nervous system is. You don't have to tell somebody they're having a bunch of pain, and you also don't have to show them that their spine is aging alone with the x-rays. They get that. What you really want to do is you want to sit down and develop a relationship with them to say, look, together we can start to make this whole system of the spine and nervous system function together, and here's the benefits of that. And the benefits are showing up in each of these tests. These tests are actually an extension of what you and I feel when we're working with the patients. So, for instance, if we want to understand the degree of pressure or palpatory pressure that a patient could feel when they're experiencing pain in a certain area of chief complaint, we can use algometry. We can literally show them how to map out that pain. Very powerful, very useful, especially if you're working with MVAs or any type of workers' comp. But what really matters is that it brings to light a picture for the patient as to how sensitive that area really is, not only on this one, but how much better it's becoming down the way. Talk about range of motion. That's another one of the 5 tests. This is critical to understand how loss of the controls, restrictions in the joints, restrictions in the muscles themselves can cause a restriction in this dyskinesia that we've been taught about. So that's a hugely valuable piece. But what goes on beyond the spine? And that's when we start to look at what we refer to as the neural efficiency tests. And these are the ones like surface EMG. Surface EMG measures the tone of the firing of those motor endpoints, and this is where the muscles are being observed to see how they're locking and guarding, how they're losing their elasticity, and this is why we use EMGs, and we can interpret it so that we're not only observing the reactions within the muscle groups, but that we can actually understand how exhausting this is. So we understand, and I'll train you how to have a conversation with patients about how exhausting it is to be out of alignment and out of balance. The 4th test, which is really fascinating, is the thermal test, and it's a window into the sympathetics, into the autonomics. By understanding how the body can regulate the temperature of the paraspinal muscles, which is, the vasodilation, vasoconstriction of those blood vessels, we can literally understand how stress, these chronic long-term stress reactions that they may be just feeling or they may not be feeling, are affecting how their organ systems, their blood vessels, and their glands are working in the system. What a beautiful piece of technology to sit down and say, listen, as your body is getting out of the pain cycle and starting to move and feel better again, hey, now we can help you focus on adjusting the tension properly in your nerve connections so that your body starts to wake up again and that you can regulate your inner organs. And finally, the coup de grace is this beautiful piece of technology which is called heart rate variability, or as we collect it, called pulse wave profiling. And this is a beautiful piece of technology because what it does is it gives a bird's eye view as to how stress generally is affecting their body's ability to adapt. And what I teach you and what I will tell you is that this is such a powerful and such a universal test. It's used by, on one hand, cardiologists to understand if somebody is in deep distress as far as their heart function, but on the other end of the spectrum, it's used by Olympians to try and understand how well they're set up to train, how much reserve their bodies have. I think that when we start using HRV consistently in practice with the combination of the NSFI, we're going to have conversations with people, throughout our country and throughout the world that will literally help them understand that their ability to rebuild their reserve, which has been exhausted through stress and subluxation, is literally coming back. And this gives great hope to people. Here's what I want you to understand is that when those 5 tests, which I've just given you a very brief overview, are put together into a one numbering system, which is the NSFI, it gives people a reference point as to how they're improving. Let me tell you, when somebody's pain and movement start to come off, that NSFI score grows. But what really starts to get exciting is once the pain is gone, they can still see an increasing number as their system starts to gain control in the autonomics. This is what the true essence of adjusting is, building back the autonomic function, building back the overall adaptability while the spine heals itself. And you can't learn all of this by looking at an X-ray only. I've been in practice, as most of you know, for up to 31 years, going on 32 years now, and I was born and raised on the principle of looking at X-rays and then, connecting the hip bone to the universe with the patient through words. This tool, the NSFI, and the subsequent other pieces to it, is so powerful because what it does is it brings to life in graphic images exactly what's going on in that neurospinal interface. Now, you and I as chiropractors know how powerful that is for people to have a cleaner, healthier system, but do they understand what's going on? And this is the tool that gives it to you. Now, what you may also be worrying about or thinking about, as I would be as a clinician, is sitting there and saying, is it reproducible? And the answer is, without a doubt. This technology has passed rigor in both validity and reproducibility and intra- and inter-examiner reliability. So I can stand behind this as a clinician myself. I'm a fellow in the sports and performance side of things, and I know that what got me into this was the idea that this stuff really needed to be validated. And the reason that I stand behind the CLA technology is that in the marketplace, this is the most researched and the most accurate system for scanning neurologically in the spinal cord. So I love this stuff. The second thing is it easy to interpret? And the answer is absolutely. The one numbering system makes it absolutely simple to interpret and report. But if you do like I do, which is to get into understanding the individual scans and how they're contributing to that score and what's really going on at different regions of their body, et cetera, I can tell you this, is that I can teach you all of that through the mechanisms we have, but needless to say, it's easier than you think. When you take a look at the scans, I want you to consider that the coloring system, which we make very easy for you, in green being a mild above normal or out of normal, blue being a moderate out of normal, red being more of a severe out of normal reading, these categorical shifts that we see in there of mild to moderate to severe really help us identify, A, what regions are under stress, but how generally the body is improving from scan to scan to scan. This allows us to give a report that is relevant to the patient, that they're moving towards an improvement, that their body is able to accept the adjustments. Beyond the pain, they're starting to heal their body. This is important points for the patient who's reaching into their pocket and paying for something, even though they feel better from the initial visit that they came for, the initial problem that they came for. So I think that you need to understand that you can build your practice around this technology. In my practice, I made a decision that it would become the central hub of my practice. It would be, as I've just discussed, the clinical hub. It would be the reporting hub. This is where we get a chance to report and develop the care plan with the patient. We get our patients booked literally from scan to scan to scan to scan, so that we can do forward booking, forward planning with our patients. In that continuum, we can watch them and report to them and give them advice and let them know that we're satisfied or that we're not satisfied. It's a beautiful piece of technology that, like I said, makes it simple to report. And thirdly, it's a marketing. It's the other part of the hub in my practice. It's a marketing hub. Certainly, in-house marketing becomes incredibly simple because we just use it to invite families or friends or neighbors in to get a scan done to see how stress is changing their health. But it also can be used in group or community settings. We use it in corporate a lot. You can take it to community where you're starting to get it out into the community through screenings, if that's something you enjoy doing, through demonstrations. We go to local health fairs. We go to local businesses such as health food stores, yoga studios, etc., and Pilates studios, and we introduce the power of understanding the tension and the health of your spinal cord. So remember again that I use it for the clinical side, which is making decisions, the reporting side, which allows us to give the killer reports that allow people to buy into and understand where we're going, and finally on the marketing side. And so this is the kind of tool that I have found indispensable for the past 15 years. Thankfully, the NSFI has come up in the past 4 or 5 years, and it makes it even easier. You might be saying also, asking, well, how am I ever going to integrate this? I use this or have used this in a one doctor, one CA office. It's a matter of scheduling it properly. You can layer the tests in, or you can do them all at once. What we can do is I can teach you how you can get this done within 18 minutes, 6 of which of the minutes are literally with the doctor out of the room. Well, in my case, 100% of the time the doctor's out of the room because my staff do all of the testing. But 6 minutes is the HRV collection where no one but the patient needs to be in the room. So the time away from the front desk is minimized. We will show you how you can do snapshots so that the re-examination procedures are so simple that they can be done in about 6 minutes. I'll show you how to do reporting on the fly so that once you have done the initial report or even a comparative report, you can report on a patient's progress validly and with great enthusiasm, literally tableside. So this is a system that runs in high-volume offices with very low impact on extra staffing. In fact, there is no need for extra staffing. So I think that I've covered a bunch of the points that would at least get you interested in understanding. Brock, you're online, and I know that you talk to doctors all day long about their thoughts, their concerns, their enthusiastic responses. What are some of the other points that I can bring forward?
Well, I would love to have you spend a little time explaining Total Solution in a little more detail.
Sure.
We've touched on that with everyone somewhat, but it'd be certainly, since you're a big part of it, I think bottom line is it's a seminar, 3.5 days We cover every aspect of how to build a successful lifetime family wellness practice that's not dependent on insurance. And that's a good way to sum it up. But do you have anything else you'd like to share on this life?
Well, absolutely. As much as I present at this program, I find it, I get to go there 3 times a year to rev my own engines up. It's a congregation of like-minded chiropractors. Everybody's searching for their traction in their practice. Everybody's searching to see, if they can keep their focus on what they really believe their message is like. And TS is one of those places. Total Solution is one of those places that just consolidates what you believe in, and we get really the most remarkable emails and conversations with people who go out of TS. I host a call 2 weeks after Total Solution with the graduates, and literally they are glowing. They can't believe that they've been able to have as much of an impactful influence in their practice in those 2 weeks than they may have ever had in their lives. And why is that? Because I think it's like anything else, Brock. I think what comes up is that people start to feel that they are not alone, that they have this community, and that they really did have a great idea. When we're in solo practice or in practice, many times there's a lot of hours that are unfilled because the times are slow, and we start to doubt if our goals are where they should be. And Total Solution is a time in which we invigorate your understanding of chiropractic. I get in there and massage your left brain and get you thinking and learning about what a subluxation is, how you interact with it. I get a chance to really delve into the clinical side of the subluxation by giving deep interpretation programs. And we also spend the time to help you realize that you can't be productive if you're conflicted in your message, and we work a lot on congruency with this. We work a lot on helping you understand your prioritizing of your needs and where your practice needs to be aligned. So I think TS is indispensable. As I said, I get a chance to do it 3 times a year, but I would love it if minimally people went at least once a lifetime so that they could experience it. It's powerful stuff. And, hey, listen, it's sitting at the bottom of Pikes Peak. It's at 8,000 feet. It's in a nature place. We take care of one another. The food is fabulous. And I always worried when I was doing it, because I've run a highly productive practice over the years. I was sitting there going, is it worth my time to take, 2 and 3 days out of practice? And as I was saying, I now do it regularly. But even for that first one, the value was spectacular. So, I'll endorse it for as long as I can. And I hope that speaks to it, Brock.
Yeah, and I think I can say I've been, Total Solution we've been doing for 16 years, and I've sent 2,500 doctors to Total Solution, and another couple of hundred didn't go. And I can certainly say that the ones who went to Total Solution had a much better, more successful result later with their technologies and with their practice than the ones who didn't go to Total Solution. So just from a return on investment standpoint, I think Total Solution's invaluable.
Well, I think that there's actually, and again, I'm maybe stepping outside of because I don't deal with the sales side, but I think that there is basically a return guarantee, isn't there not? So long as people go to TS, I think that CLA has such a confirmation about how powerful TS and their technology is that if after you've gone to TS and use the technology and done a number of scans, that there's a no risk guarantee that they can get their money back if they want.
That's correct. What we do is let a doctor get the equipment up front through financing or through a credit card, and then do at least 20 scans in their office, and then come to one of the next 2 Total Solutions. There's one August 10th through the 14th, and then there's one in November. And when the doctor comes back after they've used the equipment in their practice for at least 20 scans and really gotten to understand and watch the training and interpretation videos that come with it, and then come to Total Solution, go through the whole program, then come back on that Monday. If they're not 100% satisfied with the results they are getting and that they see in their future, they can call up and set up a return and send the equipment back. They're out of the deal, and they got the seminar for free. So
yeah, that's the confidence that CLA has in the level of change in the product that it offers. And I can tell you that over the years, I mean, you're on the sales side, so I don't know, but I can't imagine that there were more than one or two people in the hundreds and hundreds and hundreds that have actually said, no, I want to. But, I think that that's a lovely confidence builder in people to know that even at the worst scenario, if they want out, there's a way out. Right. With it. So listen, I bring that forward because I think it's valuable to let people know that if you look at neural scanning and you want to get into it and you know that there's the support and help that's out there, that after that it's just a matter of making it run in your office, and it will make a difference. And that, I can tell you, is the truth because I do it every day. Brock, any further questions before we let these good folks go?
No, I think that's it. Again, everybody just contact me at 1-770-456-0178 to schedule a web tour so we can do one-on-one discussions on what your practice would need, whether you need all 5 technologies like Dr. Fletcher has. You can also start with just our basic package of EMG thermal and maybe the heart rate variability test. There's a lot of different combinations, and it depends just more on your situation. So I recommend we schedule a web tour to do that. Remember, we're still offering the headgear promotion, which David mentioned at the seminar, where we send you an MP3 player and 12 recordings of our best on-purpose interviews by Dr. Gentempo and Dr. Kent, just for sitting in on a web tour with me. My email, again, is brock@subluxation.com, and that's all. Anything else you want to finish up with, David?
Well, just to say it's great. It's summer, and what better time than when the office is just a little bit lighter to open up a new conversation with people and make sure that they're getting into the whole story. This is the perfect time to start to integrate it into your offices. So no, and I look forward to continuously working with each and every one of you who's listening on the call to make sure that in the